Today I am here with Noelle, and I'm going to show you how to do a birthing simulation with Noelle. She's our birthing simulator. And what we're going to do today is do a nurse-assisted precipitous delivery simulation. So what you can do is actually bring your students in, bring them in 2 at a time in pairs. Turn her on and say, here you go, here's your patient. She's delivering, what are you going to do? And then that way they can kind of help each other and kind of fumble through what they're going to do. So then after you give everybody a chance to do it, you're going to say, all right, stop. I'm going to show you how to really do an RN assisted delivery. So then you're going to grab your gloves. You want to try to keep this environment as sterile as possible. You want to get some sterile gloves. If you don't have that available though, clean gloves will work. And so as you go down here to the perineum, you can see the perineum bulge, the baby's coming out, the baby's crowning. Grab yourself a towel, clean or sterile. You want to support the perineum and support the baby's head as it delivers. Got our head coming. Again, be careful with Noelle's cervix because her cervix has a tendency to want to come out with the baby. So I'm going to deliver this anterior shoulder. Gently lift up on the baby. Let that posterior shoulder deliver. And kind of help deliver the baby. And then we have our baby has delivered. You kind of have to pull the baby the rest of the way out. Then your baby should be screaming and crying, and you dry the baby off with a towel, assess it, make sure the baby's breathing. Grab your bulb syringe, do the mouth first, then you're going to do the nose. Again, make sure baby's nice and pink and crying and everything looks good. As the baby's laying here, you can grab your cord clamps and pretend like you're cutting the cord. Get something to cut the cord for the purposes of Noelle's baby. That's how we cut the cord. You're going to come over here and grab your blanket, dry your baby off, and again, it's important to tell the students whenever you are in the hospital doing a delivery like this, you want to make sure that whether it be the bed or the stretcher, that you leave the bed intact if you're doing a delivery bed, and make sure that the bed's intact so you can use that space down there to be able to work with the baby. So baby looks great. We're nice and pink. We're going to go ahead and put baby skin to skin with mom to facilitate both warmth and bonding. So we'll lift mom's gown up and we're going to put baby in there with her. You want to make sure that you remember too, because it's easy to forget whenever you're the one delivering the baby, to do the APGARs and make sure the students know that they need to do their APGARs. So, mom skin to skin with her baby. If in fact the placenta decides to deliver before the physician gets there, let the students know that their role as the nurse is to catch it in this basin. Noelle's placenta does not deliver, so you have to kind of go in there and get it. But if it does deliver spontaneously on its own, they catch it in the basin, and they're going to look at it, make sure it's nice and intact, there's nothing retained, and set it over here on the delivery table so that the physician can inspect it whenever he gets there. So this is just one way that you can use Noelle as a simulation. You can also, while you're doing this, what I usually do with my students is I start to ask them questions as far as, well, what if you weren't in the hospital setting? I've attached a case study that actually talks about a patient delivering in Starbucks. And if you don't have Noelle, you can just use that case study. And it kind of helps them think outside the box as far as, well, what can I do if I'm not in the hospital? How can I keep this baby warm? What can I use to clamp the cord with? Things like that, and to get them thinking outside the box. If you do have Noelle as a simulator, you can ask them those questions as you're doing this simulation just to kind of get them thinking. And you'd be surprised at the things they'd come up with that you don't even think about. So attached to this module are some highlights to keep in mind whenever you're doing this simulation in the lab, and then also the case study if you don't have a mannequin, or if you do have a Noelle and you just like to use the case study as well. You could do either of those things. And this is just one way to use Noelle, and she can be used for many other things, but this is how to use her to demonstrate a nurse-assisted precipitous delivery.